The other aspect we have it is fillers. And this is where the personal philosophy comes into it. You can put fillers anywhere in the face if you know what you're doing. There's lots of places you shouldn't put fillers into them, and lots of places you can put with more better technique. So when you look at fillers, it took me a while to just get my head wrapped around this concept. We're treating people, and I want to have fillers. The question is why? I want to look fuller. Why you want to look fuller? And when we look at ourselves, I mean, people look at their faces quite a bit. Actually, you look at the mirror image, you don't look at your face, really. And what do I like about my face? Well, I look tired. I look saggy. I look angry. And that's what you need to look at. You need to have what the patient is trying to do. And then, what am I trying to be? I want to look less saggy. What am I trying to look? I want to look slimmer. I want to look more attractive. I want to look younger. So on the left-hand side here, my left, is reality. On the right side is my goal, my dream, what I want to accomplish. So the way to look at it is the concept, really. Once you understand the concept, life becomes a lot easier. Is that I take in my car to sound effects to do whatever they do. My son wants loudspeakers that blows a hole in my ear. That's fine. I get a flat tire along the way. Which is more important? I have to fix the flat tire. By taking away negative features about your face, you're only left with positive features. So you're strategic where you're putting that stuff. You're not wasting in an area that looks really good, doesn't need enhancement. Why even inject anything there? Unless you're trying to sell syringes. But if you want to look for something that take the negative, chip away at the negative. Like Michelangelo said, David's statue was there. He just chipped away all the unnecessary pieces. And that's what you do with it. So you take how I feel and take away the negative features and add to the positive features. And then you have a beautiful result. It's not random. There's actually a process to this, a way of thinking about it. So when you look at someone, you need to look at their face. You have to look at them at rest with no expression. You have to look at them when they're smiling. You have to understand where the structural approach to it. There's a systematic way. Like when you're building a house, you didn't build a house. There's steps to it. You have to have your foundation, your walls, your roof, and then you do your furniture. You don't build a house, you put the TV there in the middle of an empty piece of land. You have to start with the process. So you look at the dynamic, interaction. I mean, these areas in the face, I can put 20 syringes into them. And we call them the black holes of the face, the temple, certain areas. I can put and I see no results because I'm putting in the wrong space. And I eventually get you to look right, and you're happy with me. You leave the office, you smile, and suddenly you have this big chunk that moves up and down that looks so unnatural. So you have to see what the patient looks like now with the smiling. So when I'm talking to you, even briefly, I'm actually observing your face. And I see how the lines move, the positions of the eye, the cheeks, the lips, the neck, all these things come into it. So when we're trying to fix someone, I need material. It's like asking me to make a 3-tier wedding cake and give me 1 cup of flour. Ain't gonna happen. You need to have enough material. And you know, we all get obsessed by syringes. I used to think about it like that. Here's a tablespoon, and just this little blob here, is that 1 syringe? Do you think that 1 little blob is gonna fix your cheeks and lips and forehead and temples? Not gonna happen. But each has cost to it, so you have to be strategic where you're placing that. 2, 3, 4, maybe. By the time you get into 8, 10, 12, 16, my God. But then you're getting into the cost of it. The line, we use all kinds of lines. We use the Juvederm, I used Restylane in the past. Now we're using the Teoxane RH. It's one of the, last year they won the award. Although they have a new line, RH 1, 2, 3, and 4. They actually won the prize for all of them, which doesn't really happen in this highly competitive industry. In Canada, it's highly regulated. I think we have 5 products, lines, different companies. In Europe, there's 198. And some of them are really very shady. Some of them are really good. And the way of thinking, when I started doing this, we said, you know, doc, just I have 1 line, fill it. And we did that. And looking back at it, that probably wasn't the appropriate way of looking at it. So if you have this house falling apart, and you want to make the house look better, If you ask me to fix one line, it's almost like telling me I'm going to fix this one window in the center, the rest of the house looks great. It doesn't work like that. You have to be systematic. When you're building your house, you have to build your foundation. And the foundation of the face, the area around the eye, your cheeks, the temples, that's the area you need to build. Then you build the contour, which is basically your walls and your roof. And that's the area around the mouth. By treating this, then treating this, you can take away a lot of the negative stuff. Then finally, you'll worry about your furniture and your appliances and TVs and all that. That's little lines here and there. And some people just need one line, that's fine. But a lot of people, they come with a lot of changes to them. You have to be really systematic. If you're going to get a good result, you need to build the foundation, do the contour, and do the different. Then you have a beautiful house. A beautiful house like this doesn't just happen. There's a process to doing this. The number of areas, I hope you can see this diagram. These are the points where you can actually inject someone's face. And the more complex it is, the more points. Look at the lip. There's an awful lot of injection points, 8 injection points on either side. The chin has like 6 of them. The jaw has 5 of them. And some are blue, which is safer. Some are red, which is you have to know what the hell you're doing before you inject those areas. And not everyone needs every point injected, for heaven's sake. It's just totally impractical. This is just for the filler, the injection points for the Botox and everything else. So you need to be able to give someone a good result, be realistic about it. You have to know what you're doing, know the area where it is, to avoid complications. Because people had some serious complication with this stuff. The worst, people have really had bad problems with it, if done inappropriately. But I think really like putting 5, 6 syringes and not seeing a difference is not a good thing. I had one lady come to see me. She spent $6,500 on fillers somewhere else. 6 months later, she couldn't see a damn difference. And it's just like, how can you, that's a lot of fillers, a lot of money people will spend on stuff that just doesn't work. Because it wasn't appropriate for her. She needed something else done, and she was fixing that window. And it doesn't matter how much money you put into it, it's not going to work. So when we do needles, sounds wonderful. People ask me, will I get Botox? It works. Will you get it myself? My answer most of the time is no. I hate getting needles. I can give them all day long, but I just don't want them in myself. But that's just me. I don't mind them really. So when we try to make you comfortable, so we use really this beautiful combination of local anesthetic. It can really make you, there's no zero pain, but it make you very, very comfortable. We use very fine needles, diabetic needles. We use cannulas, which is hurt way less and bruise less. And we also have the TSL pen, which was a godsend, especially if you're injecting around the lip. Beautiful little thing. Surgeons have this impulsive personality. I want to fix everything in 5 seconds. This actually forces me to watch it go slowly for a minute. And oh my God, it's torture for me. But you know what? It works. It goes it's sudden distension that hurts. This is just constant, even flow, and it's beautiful. The stuff has freezing into it. So we started using the TSL with the topical, and I'm injecting less. I used to do a dental block. I'm doing less and less of that. It actually works, bruises less, and more comfortable for the patient. Again, be realistic about it. There's different points. We do cleft lip and lip cancers and all the other stuff. There's multiple. The lip is actually very, very crucial. But lots of people go from here to here. So this is the Kylie Jenner lip. I'm sure some of you noticed that or know that by now. She made a lot of money by promising with her lip liner she could make your lip fuller. No, she had lots of injections over many years to get from thin lips to lips. Lip liners help, lipstick help, but it's just one thing. When they're more honest, don't beat yourself, I can get my lips through this. There's no lip liner will take you from this to that. But even when you get to this lip, you still have to do it every 6 months, 9 months. So you have to maintain what you get. We look at the lip, and when we say lip, most people think this is lip. This is only the red lip. The lip goes all the way from here to the chin. So it's the whole thing. In Caucasian lip, the upper lip should be 2/3 of the lower lip. In Asian and black lip, there should be 1-to-1 ratio. So you have to maintain the ethnicity of the person. The upper lip has 3 parts. Central portion, 2 sides. The lower lip has 2 parts. You have to know this. You have to know where the arteries are, where the veins are, so you can make it look normal. So you can, with a subtle, tasteful injection, you can somewhat look good. But by the same token, if you ignore these principles, I don't know which planet this is a good lip, but apparently it's a good lip. It's not for me. And the injectables are changing. Now they're into this skin booster, which is kind of an interesting concept. What it is, this is direct injection of the skin. We're not following this, but we're injecting the whole thing, especially for the neck lines and the décolleté lines, the lines in the chest here. And this is hydrating the skin, so like giving a cream to the skin. It can be very effective with skin boosters injections. There's certain serums you can use, especially before or after procedures, and there's we're gonna get some PRP, platelet-rich plasma in our practice. And you take people out, like when you go to the lab, they spin it, and with a special kit, you can isolate all the growth factors. And it's kind of fascinating. You see the indication. It cures everything. Doesn't matter, it will cure it. That's never true. It's very effective for thinning hair. It can help with some wrinkles, but people looking for other applications. I mean, just look at PRP and Google it. You'll be surprised what people can use it for. But it's something we're thinking of incorporating. Latisse is also great. This one's not going to give you what Studio Miracle will give you with the lashes, but this will make them longer for you. Once you stop using it, you lose the benefit. It can also be used for the eyebrows to thicken it a little bit. And you can do all this rusty lift and whatever you call it. If you have enough material, you can inject everywhere. Temples, forehead, around the eyes, the cheek, the lip, the nose, all that stuff. The nose, just a caution to you. Don't let anyone inject your nose unless you really trust them and they know what they're doing. And if you ever had nose surgery before, don't let anyone touch your nose. Not safe. You can really have major, major problems with that. So you have to choose the practitioners that inject you, how experienced they are, and the techniques they're offering. But you can look at the face holistically. Not everyone needs a full meal deal. If what drives you is a couple of areas, fine. But if you're looking for better results, you really need to treat it systematically and maintain them. When you say it's the first time you need 8-10 syringes, you can you're not going to need 8-10 the next. You need like 1 or 2. You maintain this result if you maintain it. So you can perpetuate the results a long time until you need for something longer.